right.
All right. Well, we
So
definitely
we
got
get started.
a jam-packed submitted questions, and I know we let people go live and stuff, so I'll let the numbers climb and I'll start talking. So, welcome everybody. Thirsty Thursday, Friday Junior, Free Game Thursday, whatever you like to call it. I am Cola Red Bell, and we are joined by Dr. Pierre Johnson. If you don't know my story, I am one of many of Dr. Johnson's patients. I went under minimally invasive robotic surgery to have a hysterectomy almost 3 years ago now. It's like approaching 3 years in September. I can't believe it. But
Damn.
3 years ago, I started sharing
It's
my
been 3
journey.
years. God,
It
dog,
will
that's
be
crazy.
in September. It will be September
That's
1st. I'll never
crazy. That's
forget.
crazy. Huh.
Crazy, right?
Uh,
I didn't got a whole grandbaby out of you and
no.
everything. Not well, not out of you, but you
Right.
know.
But they come and be like, oh
Right,
shit.
right.
I
Let me
knew it.
clarify
I
that.
knew it.
Pause. What you
Say
be
that
saying?
because you know that.
Pause.
Pause. He's like, I knew it.
Right. Well, he delivered my grandchild 2 years ago. Let me
Yeah.
rephrase it.
Pause it.
Man, that's what I said. Let me clarify that. But I said all that to say, like, I shared my journey 3 years ago. I never knew that it would have the reach that it did. That even when Dr. Johnson was encouraging me to share my story, since then there have been numerous women that have superseded my story. But I am committed to doing this because I know how scary and challenging it was for me to find the right care. So I know I'm not the only one in that situation. So I'm committed to helping other people get access to healthcare questions that they want to know, good advice when they're navigating the healthcare system, and most importantly, free game with a professional. So, with further ado, just a couple housekeeping. If you have a question tonight, please submit it in the question box with the circle around it, because it is really hard to watch the screen when you're doing a live. I don't know if you've ever done one before. It is challenging, maybe more for me than some others, but it is definitely hard to read the screen.
Facts.
You're more than welcome to talk to each other and keep me from laughing, but definitely if you have a question, put it there. You're more than welcome to send Dr. Johnson a request to join the live, and it's a mini free consultation on the spot. So please, please, we want to share with everybody. So please, it's a mini free consultation. So without further ado, do you want to pin your information in the
Yeah,
chat thing
that's right. I'm
before
gonna
we
do
get
that right now.
started? Because we get a lot of that.
Keep going.
Okay.
That's cool.
So one of the number one submitted questions that I got over the last couple of weeks, because again, we are trying to do it more frequently, and even Dr. Johnson's doing some by himself, because I thought I got fired on my day off, y'all. But he's
Nah,
doing
that's
some
that's
by
that's
himself.
that's arrogance
You
for
know,
you
it
right
was
now.
just funny though, because I was like, wait,
Like,
what?
what the hell? What happened?
But yeah, so we are going to try to, get the information out there as frequently as possible. But one of the number one things that I got submitted directly to me over the last couple of weeks, and I'm just summarizing it, so you may have said it a little different, but hey, I just found out about Doc P. What are my next steps? And so I've explained directly in messages to people that would depend on location, that would depend on insurance, but do you want to give a more like the variations of what should be their next considerations if they're just finding out about you and they want your expertise in the field?
If they want, say that again. I was
No, that's
working on this version
okay.
content.
If they are just finding out about you and they want to come to you for a consultation or book a virtual consultation, whether it be fibroids,
Endometriosis.
endometriosis,
Yeah,
yep.
so I guess I got to clear that up too, because like people, though we talk about fibroids all the time. I mean, that's because that's what everyone want to talk about. I am a gynecologic surgeon, so I pretty much do everything gynecologic. So endometriosis, adenomyosis, pelvic floor stuff, all that stuff I deal with. I just so happen to have a niche in doing fibroids. So for all those people that ask, like, do I deal with PCOS and everything else as it pertains to gynecology? Yes, um, I do. So, even annuals and stuff, I try not to do that as much. But, patients that like want to come and establish care with me or what have you and do annual exams will still provide that as well, too. So, yeah, that's that.
All right. So the first variation is if I'm out of state, then I should book a virtual consultation, right? That's what I've been saying.
Yeah, you should. I mean, unless you want to fly to Chicago, and come see me out of state, which people do. I promise. The more and more uh, clinics I have people that are driving up. I got a lady that already just, um, she's driven up. Her and her husband have driven up from Memphis twice, and now she's like paying to expedite her surgery. She having surgery next week now, so it's people driving, um, they flying. Some people just want to see me in person, and that's fine. Like you don't have to. I'm not pushing virtual consultations on anybody. That's just my own personal time that I give to people. But if you want to come see me and come to the office and utilize your insurance to do that, you are more than welcome to do
Okay. And just for the record, it is Chicago, Illinois.
that.
Okay. Because I get a lot of people like, well, and I saw him sitting on the beach in Florida, blah, blah, blah.
Damn, I
That
can't
had
go
nothing
nowhere.
to do with the surgery that he performs in Illinois.
Correct. Facts.
So Chicago, Illinois is the location if you want to come in person. All right. Now, do you have anybody waiting to join before I go to the next question?
I No,
Okay.
nobody is waiting. Nobody is waiting to join.
All right. So I'm gonna go to the next question. What are who do I contact to confirm if you accept my insurance?
So shout outs to Ariel's, like, my social media manager so graciously made a post that said everything, like, as far as insurance is concerned. So if you go to that post, you'll see the insurance question, because we talk about this all the time. I, I accept everything except for, like, Medicaid out of, well, it's not even that I don't accept it. It's I accept everything. Let's just start there. I accept everything. There's nothing that I don't accept. The problem that people have is, will your insurance cover the service? Will your insurance cover you for going out of state to come to me? That's the question. That asking my office or sending it to my office or what have you is pointless, because the answer is yes. Yes, I accept your insurance. The question that you have to get answered is calling your insurance company and finding out what coverages that you have. And this is when I speak about insurances, I'm speaking in generalities. Medicaid, whatever Medicaid you have, I take it, but the only Medicaid that will pay for my services is Medicaid in Illinois. So if you got Blue Cross Community, Meridian, County Care, what's another one? Straight Medicaid. Like, those are, and better. Like, all of those are like Medicaids that are specific for Illinois, that will cover my services. No matter where you're at in Illinois, if you're Illinois residents and you have that insurance, they'll cover it. Now, if you got Alabama Medicaid, California Medicaid, Georgia Medicaid, they are not going to cover you outside of your state. It's a state insurance, it's state specific. They have their own state stuff. So if you have a state specific insurance, they will not cover you. HMO plans are typically, now not all of them, but majority of them keep you in a system, right? That's how they keep their costs down. So they basically will provide a lower cost to you, because they're able to keep you within a network that they're able to reduce the cost and the payments to that particular network because they provide so many patients. And with that being said, they don't give you a lot of freedom to move outside of that network because they got to pay money. They lose money. So, for instance, if you have like a Blue Cross HMO, they'll keep you in whatever hospital group that you're affiliated with, and you can't really deviate outside of that because they're going to either they're going to pay more money or they're going to charge you more money, which then brings you to a PPO insurance. And a PPO insurance, typically, not all of them, but typically, they allow you, you don't need no prior authorization, you don't need to go to your primary first to do any of those things. You get up and you go to whoever you want to go to whenever you want to go to them, and they're going to cover your surgery. Now those are going to have a higher premium, meaning you pay more monthly, but you get the freedom to do and to travel to different states. From what I tell people all the time, and again, I don't count anybody's pockets, anybody money in anybody's pockets or do anything like that. But what I tell you is that it doesn't make sense to try to come up with money for surgery. Like it's expensive. If you don't have insurance at all, there is a discounted rate. That's how I'm able to offer the surgery to people outside of the country because they're seen as women without insurance. So it's 70%, a 70% discount off top. As well as anybody in the States. If you don't have insurance, it's 70% off. Not my cost. Again, when I say 70% off, it's not Dr. P like, it's not. I'm telling y'all, again, my money gonna come way later. Right now, I'm just trying to help y'all. But for people that if you have insurance, like say for instance, you have an HMO plan, you call there and be like, hey, you got to stay in this network. Don't like you can't go see Dr. P because you in Georgia and he's not in our network. What I recommend you do is just wait a few months, wait till you are in the selective enrollment period, and then upgrade to a PPO. Sure, well, I ain't got that much money, Dr. P. I don't want to do that. I get it. But think about it like this. If you're in an HMO plan, they taking out $400, $500 a month out of your check, or you paying that out of pocket if you're a business owner, then that's cool. But if you're trying to now like say, hey, I ain't got insurance and I'm trying to pay for this out of pocket. Let's just say, for instance, you try to do that. Now you're paying 20,000 plus dollars for surgery, as opposed to just waiting to the open enrollment, now switching from an HMO plan to a PPO plan. And now, yes, your monthly fee is going to be more. Let's say, for instance, on average, HMO plans are like $400 to $500. PPO plans are like $700, $800 a month, right? So if you do that, yes, you're going to pay another $300 or $400 a month. But if you say, let's say 400 times 12 is $4,800. So you pay $4,800 for the month as opposed to trying to come up with 20K plus for the surgery. This is how you use insurances to your advantage. Even if you public aid and you say, I don't have the money, you can figure out $4,800 as opposed to trying to figure out 20,000. That is my advice to you. I can't give no more free game. I would love to be able to. No, I won't. I can't fly to everybody and do surgeries or whatever. I'm just one person that's just crazy talk. It doesn't work like that. I can't come to your particular city and do your particular surgery and be your particular doctor. I just cannot do it. Number one, there are regulations. I have to be certified in every single state that I operate in, not only every state but every hospital. So I can't even operate in all of the hospitals in Chicago. I can only operate in the hospital that I have credentials in. If I want to operate and say at Northwestern, now I have to go through their entire credentialing process to be credentialed at Northwestern to do surgeries, and I'm not. And that takes months, it takes time, it's painful, it's not. So it makes sense what most doctors do. They're credentialed maybe a one, two, sometimes three or four hospitals, just depending. And they're credentialed, and you have to basically do all your surgeries and stuff at those particular hospitals. You can't just go operate and do stuff wherever the hell you want to do. So I hope that answers the insurance question and puts that to bed. Because if I'm going to refer back to this, and I know Ariel's on here, so she can just take this and copy this or what have you. Is that I am so tired of talking about these damn insurances, but that is like putting everything in a nutshell and just telling you, telling you without telling you how to get through it. Like if you need surgery from me, I'm giving you how to do it. And to that point again, Cola, as I always say, I want y'all to be very clear. I am not raking in a bag operating on y'all in these fibroids, right? This is not, it's really a bad business model for me, right? It's not advantageous. I make money a lot of other different ways other than sitting over a person for 5 or 6 hours getting $1,000 or $2,000. It is like it's such a waste of my time. Not waste, I won't say that. That's horrible to say that. It's not a waste of my time because I'm invested in somebody doing it. But if you look at it from a business standpoint of like me trying to make money, it is not a very efficient or smart way to invest my time. Because otherwise I can make, $400 or $500 an hour as opposed to the $100 an hour I am like put doing surgery or something. So it's a lot. Like for instance, Tuesday there my patient's being discharged now, 12 and a half pounds. For that 12 and a half pounds worth of fibroids that I removed through an incision like this, um, is it took me 6 hours. In that 6 hours, she has great insurance, but her insurance would probably reimburse my practice or reimburse the hospital for my particular services, maybe 3K, 2 or 3K, right? Which is not horrible, but it's not that great either. Other patient, it probably took me another 6 or 7 hours. It probably reimbursed maybe 1,500 or something. It's not great. Like women's surgery does not reimburse like that or what have you. I am doing this because I love y'all. I'm trying to see Black women win. I'm not gonna be able to do this forever. I've already said that there is a timetable in my head of how long I'm going to be able to do this. So that's why I'm trying to give as much of my energy and as much of like my sacrifice to women while I can do it. Because at a certain point, I'm gonna be like, nah, man, I'm doing this. I have to look at the money aspect of it or what have you. I'm not doing that yet, but just all that. I'm gonna keep rambling. Let me shut my mouth. But
No,
um,
it's good to hear that though, because sometimes and I've had this conversation with
yeah,
you several times.
yeah,
Sometimes as a service provider, people just really think a certain way when you work for them, and it's just
right,
unreal sometimes the entitlement that comes
yeah,
in the territory. And like you said, I could personally attest to at least 3 years ago, you being the lowest person on the
person
totem
on the pay
pole
on the
for
top
the
of getting paid.
reimbursements. Like
Correct.
I have good insurance as well, so they give me a full breakdown, and I can personally say that when I looked at that and I know
You be like,
all the
what?
precautions, that I was like, well, he got the less, like
The
he
least
spent the
amount of
most time there
time
and
doing
got
everything
the
right.
least amount of the money.
Correct.
So they definitely don't. I mean, like I said, and I have good
Mm,
insurance. I have very, very good
you
insurance.
do.
I have a
Right.
PPO. I keep a PPO because I'm picky. So,
Yeah, it's like, and it's really that way, and it's a bigger issue of women's health care, right? So it's very misogynistic. The country that we live in, like it just is what it is, So the taking out a prostate or doing prostate surgery will reimburse 5 times more than a hysterectomy or doing women's surgery or a myomectomy. Working on somebody's bones will oh my God, the reimbursement for that is 10 times what it is for uh operating on women's parts, or whatever. It's just misogyny. It just is what it is. But and I don't complain about it. I'm in a profession I am. This is what God called me to do, so I'm not really tripping about that. But when y'all say stuff like my insurance paying him to do pause. That's the quickest way to agitate my soul. Don't do that because it's not. I literally am sitting here doing this stuff not getting paid, not doing anything because I care about people and I'm doing that for people. The woman that came, like at the surgery I performed yesterday, horrible endometriosis. She had two myomectomies. It was a mess where I could have just been like, you know what, I'm not doing this, right? But 6 hours in there, you know, trying to preserve her uterus and removing every fibroid that she has so she can have an even opportunity to have children. Never will see money from that. It just is for the love. Hope God sees it and bless me in the afterlife. But other than that, it's not because it's reimbursing me. So please don't believe I'm just getting rich off of trying to push surgery. And that's the other thing. You just trying to push surgeries on people. You just trying to get all of it. I say thank you for when people try to like refer me or like say, okay, um, go see Dr. Johnson or whatever. Like, hey, I'm sending everybody to you. It's not because and I say thank you because I just thank you for giving me the opportunity to be able to help people. But I'm not saying thank you because I'm getting rich off of it. I'm literally saying thank you because it's giving an opportunity to somebody that probably just did not have that opportunity. But some people think it's like, hey, you just this is your moneymaker. You just trying to get on here to do these fibroid surgeries because you're trying to get paid off of it. That is so not the case. I swear to God, it's not. It is not.
Yeah, you could
But yeah,
definitely sell out and get a tea or something if you
man,
want to get
I'm
rich.
telling y'all ass,
I
yo, I'm
told you
telling,
about the
hey,
washcloth.
hey, let me tell you. Oh, I just thought of a horrible. I like. What if I get like a specialized like nut rag or something, like
That's
something
why I said
just
it's a
crazy.
washcloth. I said
Nut.
it much nicer than
It's a
that.
nut rag. Hey, we grown. It's a nut rag. Shit, why not?
I was
Why
being
not?
nice
Oh,
when I
yo,
said it.
hey, 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 everybody on here, you know that wet spot. Hey, y'all know what it is. Hey, I promise y'all, in a couple of years, I swear to God, y'all gonna
I've
see my
been
name. It's
told you
like,
that. I was
y'all
like,
gonna be like,
man, just get you a little washcloth. They get
yo,
they
y'all
bad.
gonna be, I swear, y'all gonna be like, this motherfucker sold out for real. Like like I see Dr. P on all this bullshit, his teas, his rubs, his all type of shit. I'm like, yep, goddamn right, yep. I'm just getting paid. I sold my soul. Yep, call me whatever you want to.
All right. Well, I'm gonna
All right, let's get to
I'm gonna
business. I'm
ask the
talking crazy.
questions nicer. Next one. So, if on average, when traveling for surgery, how long does one have to plan to stay in Chicago?
Perfect question. So, average, whether you get a hysterectomy, myomectomy, which are the two most done surgeries, is typically a week, right? So it's a Sunday to Sunday, Monday to Monday. That's where you're at. Now, again, that could be a little bit less. That can be a couple of days more, but typically no more than 8 or 9 days, even with a myomectomy. Like for instance, um, some, some patients that I do myomectomies on Tuesday, they'll come in for surgery. They'll come in and fly in on Sunday. On Sunday they come fly in. Monday they chill. Tuesday is surgery. They're in the hospital. Wednesday, Thursday get discharged on Thursday. Friday, Saturday, I want them to stay in. If everything goes pristine, perfect, no issues, everything is phenomenal, no pain, everything is great, they could fly home Sunday. But something that could possibly happen, which I'm way more liberal about doing now, is that if your uterus is oozing things and things of that nature, like I put a drain in, like a JP drain, just like you see the girls walk around with the little bulbs and the BBLs and walking around with that, I put those into the belly to drain the blood out, and that's because saving your uterus is a task. If it's got a whole bunch of fibroids riddled through it, that means I got to take all of them out, and that fibroid and that uterus is going to continue to bleed, and I have to get that blood off of your belly while you heal until it's at a point where your body can reabsorb it. And for that, those patients may stay in, instead of leaving Sunday, they'll stay in till Monday till I can remove the draining clinic, and then you could fly home that Monday night or Tuesday. So it may extend it to 8 or 9 days, just depending. But flexible travel, Just be prepared for a week, possibly 8 or 9 days. And direct answer to the question.
All right. Next question. Have you seen anyone with adenomyosis and endometriosis having more than one myomectomy and still having successful pregnancy?
It's tough. I mean, it's like, can it happen? Yes. But it's just putting more roadblocks into that pathway of pregnancy. Pregnancy is a very difficult thing. Like people think that like, oh, she didn't have 8 babies. Like it's just an easy thing. No, the fecundability, this word is a kind of weird word, but fecundability rate is the percentage that a person can get pregnant every month. And that ratio is about 20%. Like, so you only have a 20% chance every month with everything healthy, healthy sperm, healthy eggs, ovulating, normal periods, healthy mom, all that stuff. You got about 20% chance in a given month to get pregnant. Now, the more factors that you add into it, the more and more and more and more you decrease that ratio. So you add in a low sperm count, poor quality egg count, blocked tubes, adenomyosis, endometriosis, advanced maternal age. Like you start to add in all of these factors, you just decrease the success rate of pregnancy. Can it happen? Absolutely. Mary got pregnant with Jesus. It happens. You can put enough factors into it. It's going to, it's it, it puts you at a low risk, but I'm very, very careful about ever telling anybody, oh, you can't get pregnant. It'll net, you can't or whatever. I never tell a woman that. That's the crazy talk because we're not God. I'm not God. I can't predict those things. But the more things that you add, the more negative factors that you add into it, the lower the rate. Have I ever seen a person with endometriosis and adenomyosis get pregnant? Yes. But I also seen hundreds of women that have both of these bad diseases that had all the difficulties in the world getting pregnant too. So hope that helps.
How much scar tissue forms when removing multiple fibroids?
That's a tough question. So, scar tissue is something that's thrown around a lot, right? And people that don't actually operate or don't actually deal with it, it's a hard concept to understand. What I will say is this: everybody heals differently, right? Just like, some people can fall and scrape their knee and two people will have the same big scar and one of them will keloid bad and the other one is like you never see it. It's like did you even fall, right? Everybody heals differently, so it's hard to say how someone's body reacts after surgery or how extensive scar tissue will be, because that's all scar tissue is just healing tissue that's been damaged and now has to heal. To that end, you reduce the amount of scar tissue by performing surgery very meticulously, right? Putting things back together appropriately, not cutting things excessively, not overburning things. There are adhesive barriers that can be utilized after surgery to reduce scar tissue and inflammation. It's multiple things. So if someone has horrible scar tissue, it's not always necessarily because they were just unlucky or just because they had surgery. It's about who did the surgery, how they did it. Like, were they not meticulous? Were they just cutting or whatever? It's levels, as I tell you, it's levels to everything. It's always levels. It's levels to lawyers. It's levels to hairdressers. It's levels to cab drivers. There's skill levels to everything that's out there. So um, surgeons are no different. So your level of scar tissue is is also predicated by the skill level of your surgeon and the meticulousness of how they perform surgery. I hope
All right.
I answered that.
Yes. All right, so I see the numbers changing a lot. Thank you for joining tonight. If you have a question, please feel free to drop it in the question bubble with the question mark in the inside. That helps us keep up with them, and it's harder to read the screen for us. And then, if you would like to join the live to ask your question yourself, please feel free to send Dr. Johnson a request. It is a mini free consultation, but we are more than happy to have you join the both of us.
Yeah,
And you
somebody
can
popped
ask
on there, but then
questions
they left.
to me too, a patient questions,
Yeah.
because people send me medical stuff, just the patient stuff, please. You said somebody
They
requested?
did, but they popped off, so it's fine.
Okay. All right. Next question. This is a career question. Do OB techs help assist you in surgery when you are in the hospital? And if so, would you recommend that job to someone who is considering being a labor and delivery nurse?
So OB techs, and I try not to speak about a ton of things that I don't know, so I'm not fully versed when it comes to nursing and all of the pathways and things that you can go down. So if it's somebody on there that, I may be saying something that not be all the way correct, I am not doing that on purpose. You could chime in at any point, but I can just tell you what I know and what my experience is. So OB techs is anything with OB or obstetrics. It's kind of obstetrics driven or focused, meaning that if you're an OB tech, you're pretty much on the OB floor dealing with the OB patients or obstetrics patients. That has everything to do with C-sections, deliveries, and those things or whatever. That's your focus. Um, and so for me, I don't practice obstetrics uh, currently. I have not practiced obstetrics for some time now. So I'm strictly gynecologic based at this point. And so for OB techs, when you get the training for OB tech is typically OB specific. For people that would assist someone like me, those would be surgery techs, right? Surgery techs, it, which I believe, well, no, there are OB techs that did not get their surgery tech certification, but surgery techs um, are have like more of a wide range of things that they can help with. Like so, when surgery techs, they are in the main operating room and they can assist with orthopedic surgeries, assist with gynecologic surgeries, assist with cardiothoracic surgeries. Like they are well versed, and it's a schooling that they go through to be able to assist in all these surgeries. I have a cousin that does it, and he went through school, and he is a surgical tech, and he assists in all of these different surgeries. Not to say that an OB tech cannot, but I believe that OB techs are more specific for OB. And for obstetricians that do a lot of vaginal deliveries, a lot of C-sections or whatever, that's where OB techs are very instrumental. So if you really, really like OB and you want to stay in the OB world, absolutely look into OB tech. But if you like fibroid surgeries like I perform and other surgeries like orthopedic surgeries and those things than actual surgery tech where it gives you that full scope of experience to be able to do that makes more sense for you.
All right. Next question. If I have a 10 to 14 centimeter large fibroid and my current doctor is mentioning possible hysterectomy, should I consider egg retrieval or myomectomy or both? And I don't know the age of the person.
So so number one, I will just depending on your age, I would also always talk about freezing eggs or egg retrieval, right? Because you know at best case, after you get your myomectomy, you can't get pregnant for 6 months after that, right? So it's like having an insurance policy. Nobody on here would drive their car without having car insurance because if you get into a car accident, you want to call your insurance company and say, "Hey, come fix my damn car," right? You don't want to get into no total wreck and have to pay for all of that. no different with egg freezing or egg preservation because you pay monthly for your car insurance and you never use it. But if you get to the point where you get to the age where you want to have a child, but you don't have the egg quality, you want to call and be like, hey, unthaw the eggs that I gave y'all 5 years ago because I need to use them. You don't want to get to the point where you 40, 41, 42, got poor egg quality and don't have any other options for eggs and you can't extract your own. So I would always recommend anybody that is in their late 30s, at least, or sometimes even in your mid 30s, depending on what your egg quality is, to look into egg preservation if you're not having immediate plans for pregnancy. As far as hysterectomy, myomectomy, everybody is different. It depends on what you want, what your plan is for pregnancy. I will repeat it and I always say if you have a viable plan for pregnancy, nobody should ever tell you that you need a hysterectomy, right? You should always be able to have the right to preserve your uterus if you're going to use it for pregnancy. If you're not doing that, then hysterectomy should be on the table if your uterus is giving you problems. So I want you guys to listen to. I'm very careful with my words, and I want you all to listen to it. I didn't say women should just have hysterectomies. I use very specific words about what your goals and what your plans are, because the truth of the matter is, if your uterus is giving you problems, the only reason that you save it is for having a child. If it's giving you problems and you have absolutely no intention of having a child, then hysterectomy should be on the table. But if you don't have any problems at all, right? Even if you have fibroids and you're not having any problems, then you don't need surgery. Hysterectomy is not an option. Nothing really. You don't need surgery. So but everybody's different. And as far as a 10, 12, 14 centimeter fibroid, the options for that, you have many options. You have many options for hysterectomy, you have option for myomectomy, you have option for medications. You even have options for accessa if you really want it. But it comes down to your goals of what you're trying to accomplish. If you really want a child, you really should be having a very concerted conversation about your expectations and how to get you to the point of what you're trying to do.
All right. If you are booking a virtual consultation,
Hmm.
should you present all of your medical records? And if you have imaging, such as a CT scan, how old can it be to bring to the virtual consultation?
Perfect question. Awesome. Virtual consultations. The main thing I need is the report, not your image. I just need the report from your MRI or ultrasound. If you have an MRI or ultrasound within, I would say, 2 years, um, if it's longer than more than 2 years, it's okay, but 2 years or below, an ultrasound or MRI is a report of those is not what I need. Please, y'all, stop sending your disc, coming in there with your disc. I can't access them things. If you look at your Mac or your computer right now, you do not see a CD or DVD drive in them things no more. They just don't have them, and nobody's gonna walk around with these DVD drives either. So unless they give you a zip drive, that's just a waste of time, honestly. Just I just need the report because the report gives me a strong idea of really what you're working with. And that's all I need to be able to talk to you very, efficiently about your treatment options and what you have going on and how I can help you. So just a report. Note, I did not say anything about a CT scan. CT scans for gynecology are damn near worthless. I don't want a CT scan. If you do not have it, ultrasound or MRI, That's what I need. The CT scan, it'll give me an idea, but it's really not helping me much. Just the report from the MRI, ultrasound. Now, if you have something like an endometrial biopsy, or if you have like a weird pathology finding um, like your cervix, or just from pap smears, colposcopies, those things, that those are helpful. But I do not need 70 pages from your doctor for the past 5 years talking about everything that you've done and every visit for the last 5 years. I don't need that. I literally need the report from the ultrasound or MRI and any pertinent labs that you may have, like a blood count or something like those. Just the labs. The sheet on there with the labs is cool. Other than that, all of that stuff is just, it's not necessary. And to that point, last thing I'll say about that, hear me clearly. Your insurance pays for services, right? So when you get an MRI, when you get an ultrasound, when you get anything, it is your property, right? So when you call your doctor and they tell you that, oh, we can't give you this report, or oh, you got to go through these hurdles and hoops or whatever to get that, know your rights. Know things, right? That is your property. If you want a copy of your ultrasound or a copy of your MRI, you get that. Now they may charge you a fee. They may charge you a $25 fee or something, whatever, and that's okay. I mean, it's not okay. It's garbage. Like, I would just give it to you. But if that's their policy, that's fine. But they should never, ever, ever tell you and you accept, well, we won't give that, or we can only send that to. That's another thing to tell you. We can only send that directly to your doctor or hospital. No, it's yours. If you want it, they have to give it to you. I get that all the time, and it's easier to get it yourself and send it to me, as opposed to trying to request it from them and have them send it. Because if you get it, you can screenshot it to me, you can email it to me. It's just boom, 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 boom. If you rely on them to send it, once you fill out that paper, it goes under a stack of other papers, and they may not get to it to send it to me for weeks if they send it at all. So don't get mad if you're like, I put that request in weeks ago or whatever. We ain't still ain't got it. We're not hiding it. It's just how hospitals, clinics, that's how they operate. But that's some more free game to just let you know everything that is done to you is paid for by your insurance, and it is your property. It's your labs, it's your results, your stuff. If you want it, you can have it. You just have to be very direct and ask them for it.
All right, excellent. Oh, wrong screen. Sorry. All right. Um, can fibroids stay the same size for years with no threat to your
Yes,
well-being?
that happens. So, just because you have fibroids doesn't necessarily mean you have to do anything about them. And sometimes they don't grow. What we don't know is why some fibroids get to astronomical sizes, and why some can just be 2 centimeters and never grow over 20, 30 years. Like, we don't really know the answers to that part, because most women have them. We just don't know why some of those women grow crazy and other ones don't. So, I'm not afraid to say we don't know. It's always, we always answer driven. Gotta have answers. Gotta have answers. Some things just don't have an answer. I'm sorry. It is what it is. And don't shame anybody, because, and that's the biggest, like, do not shame people because they have abnormal growth of fibroids, or they have advanced fibroid disease. Like, stop it. you know if you don't know, like, if a man says some of this shit that y'all say, we would get canceled, right? But y'all say some of the worst shit in the world, right? Stop asking her if she's pregnant if you don't know she's pregnant. That's crazy. Like, just imagine carrying around a fucking growth for years, and somebody asking you pregnant all the goddamn time, or asking you, or even worse, why you let it get like that. I was like, oh yeah, I woke up this morning, it was like, yeah, I want this motherfucker to grow today. Like, yeah, it's time to grow, get big on me. Not like, they're not doing that. But to that point, you're not. If you were in a position where somebody was told you that they were going to rip out or cut out something that you want to use to have children or procreate, or they were going to cut you from your privates to your chest, you say no too. And you say no, 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 until you find somebody that says, all right, I can do this in a way that's going to not hurt you and to help you. And sometimes that takes years. It takes years sometimes for women to find me, right? Or find somebody like me. But to that end, like this, sometimes the shit keeps growing. If somebody told you in 2019 that I have a page, like I don't know if Q is on here or not, but she literally told me like it started growing crazy on her in like 2021, right? And that's when she first noticed it. And every person told her like they gonna cut her vertically. She gotta have a hysterectomy. She don't have no kids, young woman or whatever. And she just said no. Before she looked up 2 years later, damn thing is fucking what, 17 pounds? Yeah, 17 and a half pound fiber. That's it just happened. It abnormally grew like that over a very short period of time. All right. And for that, she's getting crucified, vilified by all of y'all that's talking about, you know, man, why she let it get like that? She don't take care of herself and all that shit. Like, come on, man, y'all. That's corny. It's whack as hell, you know. But people like get to say stuff like that or whatever, and don't have to face it. And and me hear me get my feelings where I say, hey, find somebody that's gonna help you, whether it be man, woman, transgender, boy, girl, whoever the hell it is, that's gonna fix that shit for you. And now I go viral, and now I'm the motherfucking pariah and predator, and like y'all kiss my ass with that shit. It's just crazy. It's absolutely insane, like the mentality that we have, man. But like, just for me, if y'all hear nothing else, like, be sensitive of the shit y'all say to people, man. Like, it's really, y'all have no idea how many tissue boxes I didn't pass to women. Um, with finally hearing somebody that'll help him, the years of just built up like pain and anguish and frustration of people asking them if they pregnant and they can't go outside or go to family functions because they bleeding and getting ridiculed by people. Shit is absolutely insane. Just have some compassion for people, man.
Definitely. I could personally relate to being asked, was I pregnant? I can definitely personally relate to having to sit in the house for 3 days at a time. I wanted my husband to join because I wanted to ask him some safe
Yeah,
questions.
bring
I
his
never
ass on
know
in.
what he gonna say.
Hold
And
on,
he just, that's why I was laughing.
let me
He
grab my
texted me and said,
cord. I'm
I'm
listening.
going to watch the game next time.
Damn, yeah, yeah, tell him, yeah, and I'm about to watch it too. I'm about to be with his ass in a minute,
So that's
but
why I said, "Oh, excuse me, I didn't know it was a game."
it
But he said
is.
he texted me like, "No, next time I'm finna watch the game. Let me know when you done."
He's like, pause. I want to see everything I need to see. I ain't
Exactly.
I ain't mad at
So,
him.
but I definitely wanted him to talk about, just from a husband's perspective, or a partner or a significant other, whatever you have going on, a situation. Just some of what the partner deals with, or sometimes for me, it was almost because you get asked those questions like, "Are you pregnant? What's going on with you?" It's like your dirty little secret that you don't even really want to talk about. So I also wanted him to talk about what he feels that I could have did, or that a woman could do to even have your partner support you better, because I was hiding mine from almost everybody around me. I mean, like, seriously serious, like I was going through extreme stuff to hide my secret, or my side effects or whatever.
Right.
So I wanted him to talk about it, but I'm still working on him. I have to ask him safe stuff though, because he'll be talking about nut rags too. So we gotta ask him safe stuff. We gotta ask him safe questions.
I'm telling you, hey, my wheels turning on that nut, right? I gotta figure that out though.
I was trying to tell you.
I gotta market that shit right.
I got a slogan for you. All right. We'll talk later. All right. How would you know? Okay, wait. It's a two-part question. Can large
Oh, there go Q right there. I was just talking about you.
can
No, I'm sorry, bro.
Oh, so that's okay. Can large fibroids cover your cervix? And how would you know if you needed a cervical cerclage during pregnancy? And I hope I said that right. Okay.
Cerclage. All right,
Yep.
so
That
Yeah,
part.
so can large fibroids cover your cervix? Yes. Um, the answer to that is yes. But a cerclage, so let me explain what a cerclage is. So a cerclage is um Q, you gotta go back and hear it. Nah, you too late. She's like, what you say about me? Nah, you guys go back and listen. But cerclage is when a woman has cervical insufficiency, meaning that your cervix starts to dilate before you are time before it's time, right? That's where preterm labor can happen, where your cervix starts to open up. Fibroids rarely impact that. It's not really I've rarely seen a fibroid now cause a woman to have cervical insufficiency. Can it happen? Yeah, that is really unlikely. You don't really know if you have cervical insufficiency till you know, meaning that um unfortunately it's one of those things where you that's why it's important for prenatal care and going to the doctor to see about things, because it's very subtle signs that your cervix is dilating early, and ultrasounds will detect like if that's happening. And until it happens, sometimes, most of the time when women have to get cerclage is because they had an early loss, or it's because they went through it first. Not to
Mhm.
say they did anything wrong or what have you, but that's usually what happens. You don't know until you actually know that you have cervical insufficiency. But one way to catch it also too is just to be very proactive about your healthcare, especially during pregnancy, just to make sure that there's the appropriate cervical length. But in direct answer to the question, as far as uh, the fibroids impacting, opening the cervix or anything like that, then no, it can happen, but it's not something that you would know at the time, because I've had fibroids that are, close or on the cervix or what have you, and women still get pregnant and have normal pregnancies, and it hasn't really impacted them. So can't really say that it does that. You just gotta kind of wait and see.
All right. Next question. I went for an ultrasound and they said that they can't see my right ovary. Is that possible?
Yeah, that's possible. I mean, ultrasounds are. It just depends on who's doing it, how much time they feel like taking, or what have you. Sometimes you can, have bowel in a way you may be a little bloated, or constipated, and stool is in the way of actually seeing it, or you may have a fibroid or something that's in the way, or abnormally large uterus. If they maneuver enough, they usually can get it, but they just some don't really either have time or patience to go try to get it. So if they don't see it, then that means that there's nothing really wrong there. So if you don't see an ovary or what have you, I would not be upset about that. It's just literally like they just really just didn't take the time to look for it, or there's something obstructing to the point where they can't see it. But if there was actually something wrong with that ovary, they would see it no matter what. Like if there's a big cyst on that ovary, then they would see it. If they don't see it, that means it's typically normal.
All right. What if your, but circling back to the egg retrieval question, what if your fibroids are blocking you from the tests that's used for egg retrieval? What is the timing between removing the fibroids and then doing the egg retrieval
I,
process?
I say a month. I actually have a patient right now that's going through this, that is, figuring out this same process. She has advanced fibroid disease, and I was sitting on the consultation with Dr. Erica Loudon. If you all do need fertility consultation, I'll shout her out. She's absolutely awesome, and that's who I refer my patients to. But but I was sitting on the phone with both of them, um, the patient as well as Dr. Loudon, because it was her fertility consultation. Just giving, just having a whole powwow as far as like what her options are, and does she go to surgery, or does she freeze her eggs or what have you. And she has the issue in which one of significant fibroids, and it then becomes a issue of uh, taking a risk. If you if you can get eggs, absolutely. If you can only uh, access one ovary, then it's where you're at in that process. But for me specifically, I told them to give it at least a month. So if you have fibroid surgery, I say wait for at least 4 to 6 weeks before doing an egg retrieval. And sometimes that will be up to the fertility doctor if they want to wait a little bit longer than that or not. But I say 4 to 6 weeks.
All right. Are EMBs required before surgery over 40?
They're strongly recommended. So EMBs are endometrial biopsies. Endometrial biopsy is a sampling of the lining of the uterus. It's recommended that you do that before performing hysterectomy myomectomies to rule out cancer. Um, do you have to do it? I tell them patients all the time, you don't have to do nothing but stay whatever color you are, pay taxes, and die. That's all you have to do. So if you just say, hey, I don't want to do that, I just want the surgery, I have patients to do that. It's very rare that it's a cancer, but it may be. And so till that end, you have to accept the consequences for that. Like, it's a low risk. You're taking a very low risk, but if you have the information that it's a cancer before surgery, you don't perform that surgery at that point. But if you're just taking you know the 0.001% that it's not a cancer, and just go ahead and do it, as long as you're correct, it's fine. You avoided the EMB. But if it's incorrect for that one and several, hundred, several thousand patients that it happens to, it's not great. And to that point, I have a patient right now, um, that if you look back on my page, like the GoFundMe is for, a patient that I have that she did that. She actually did have an EMB done that was actually normal and still had a cancer on top of that. So um, it's not 100%. It's something that it gives you a good idea, but it's definitely not 100% that um, you know that it's going to rule out the cancer or not. Let me charge on the
All right. So how are we looking on time? Because it's 1 hour so far.
phone. Man, we I would say we get 10 more minutes because I'm along with your husband. I need to watch the game too.
Everybody just cutting out on us for the game.
Hell yeah, it's a good one.
That's what that's what I guess he was saying. Because I'm like, I'm hungry
Mm-hmm.
too. He like, I'm going
Yeah,
to eat and everything. I'll just call
yeah,
me when you're done.
he doing it all. Absolutely. Yep, I heard. Yep, see, Ariel was like, wrap it up. Yes, I agree.
All right. Competing priorities. Um, what are the effects of unbalanced women hormones? I am getting a lot of chin hair growth and I am only 32.
Damn, what? Say it again. What's up?
What
What?
are all the effects of unbalanced women hormones? I am getting a lot of chin hair and I am 32. Chin hair growth.
So, so chin hair growth could definitely be an indication of PCOS or polycystic ovarian syndrome. It also could be the signs of some other metabolic abnormalities as well too. So, it's definitely worth going to your doctor to really figure that out, and you start with your OBGYN. So for PCOS, um, you have two of the three following criteria: either abnormal or male factor hair growth, or signs of androgenism, meaning deepening of your voice, hair growth not only on your face but on your arms, but like thick hair growth, mustache, beards, those types of things. Two are um, polycystic ovaries, on ultrasound, like ovaries with multiple cysts on the fibroids. multiple cysts on the fibroids. I'm sleepy. Multiple cysts on your ovaries on ultrasound. And last but not least, oligomenorrhea, which is spaced out periods that come like once every more than 3 months. So if you got two out of those three criteria, you meet the criteria for polycystic ovarian syndrome, and that's a whole nother conversation of things as far as treatment and stuff is concerned, to help you with that. But like I said, you listen to symptoms. Your body gives you signs and symptoms. When things are not normal, you have to investigate them. You just can't watch them. So if it's something that's just happening all of a sudden, it's not to just say, hey, I'm gonna go get a new razor or a Bic or whatever and just cut the stuff off. It's like, hey, make sure that metabolically you're okay and that there's not something else going on in your body.
All right. Um, what causes a fibroid to be, sorry, what causes a fibroid to be necrotic, and does a necrotic fibroid mean emergency surgery? And I think I'm saying that right.
Necrotic fibroids happen from the absence of blood supply or when they outgrow their blood supply. So case that I had a couple weeks ago where um she the fibroid had like it was like a maybe a 14 centimeter fibroid, but it had a really itty bitty stalk coming off the uterus, like really pencil thin, like stalk off the uterus. And because it didn't have the blood supply going to it, it has started to like commandeer or like recruit blood for, so like it stuck to her bowel and it had blood supply coming from her bowel there. It is stuck to her, omentum and have blood supply coming from omentum. So when tissues are dying or they get too big and they don't have the blood flow, they try to do everything possible. It's like somebody that's drowning and like do all this flailing trying to get air, oxygen. Is the same thing. Like fibroids can outgrow their blood supply, and to that they can die. And necrotic fibroids really, come from that. It's just dead tissue. Also, too, when you have uterine artery embolizations where you cut off the blood supply to tissue, you can cause a necrotic fibroid just by cutting off that blood supply. And yes, it is. It can be very painful if you cut off blood supply to anything. If you sit right now, if you go sit on the toilet, if you don't have that big cushion on it, if you go sit on the toilet right now and you like read a magazine, you just let your hands off of that, let your legs hang off of the side of it, um, your legs is going to start to go numb. And if you sit there too long, it's going to really numb, get really numb, and it's going to start to hurt. You start walking, it hurts because your legs are numb. Or you just cut your blood supply off, to your lower extremity, as well as like nerve impingement too, that accounts for that. But to that end, it just shows you like once you cut blood supply off to anything, it's painful. But that's what necrotic fibroids are. Necrotic fibroids are just um, tissues that die, and it's usually because they don't have the blood supply.
All right. We at 10 minutes. Keep
We
going.
got
Oh,
we got two questions.
two more questions. Okay. I'm gonna pick two more. I've been screenshotting while you was talking too. So I do have questions. I'm keeping a running tally on the list and marking off what I already answered.
What you say,
Okay.
Ariel? A virtual consultation raffle? You said, all right. Well, all right. We'll do a virtual consultation raffle. I don't know what you want me to do with that. But okay, go ahead. One virtual consultation raffle. How are we gonna do this raffle? How am I gonna do this?
Are you
That's all right. Keep
oh
going. No, I'm just reading what she's talking about. So she in charge of all the social media stuff now. So
oh okay. A
I just
virtual
listen to her.
consultation raffle.
Hmm.
It sounds like a cool idea.
Got you.
All right. I had fibroids when I was pregnant with my daughter. One of them was removed during labor. I still have some, but my doctor claims they are too small to remove. But I look 3 months pregnant and I want them all removed. I already have kids. I'm 38. What would you recommend?
She want fibroids removed. Say it one more time. What?
I had fibroids when I was pregnant with my daughter. One was removed during labor. I still have some, but my doctor claims they are too small to remove. But I look 3 months pregnant. I want all of them removed. I
I
already
mean,
have.
and how
Oh,
long ago she delivered her baby? What is that?
oh, it don't say how long ago. If you could drop in the chat how long ago you had the baby.
Because that might not be the fibroids, Mom. It's probably not the fibroids. That's. I'm just, I'm
My
just
kids
saying.
are Irish twins, so
Everybody,
I understand.
everybody. Listen. So if it's 2019, I would have to see how big those fibroids are. So if it's I, from an exam, I could tell you because like sometimes y'all think that um the fibroids are uh causing your belly to be huge. But if it's unless that fibroid is greater than 10 centimeters, it is unlikely to cause any protrusion of your belly, right? So, um, yeah. So it's if they're saying that it's super small, then that means it's probably not that. This is, fat accumulation. This is, yeah, this is fat accumulation that's causing your belly to protrude. Going in there to remove small fibroids is not going to give you a six pack. Put it that way. I can examine you, and a good doctor should be able to examine you to see um, if fibroids are causing an issue. But fibroids are causing you an issue, nobody's going to say, oh, they too small to be, you know, that they're going to be sizable fibroids, and you would know that. Um, yeah, so removing 2, 3, 4 centimeter fibroids is not going to give anybody a six pack. It's just not there. We're talking about little bitty small things like that are inside all types of stuff. They're inside your belly, that's covered by peritoneum, is covered by fascia, covered by muscle, on top of fat, then skin, right? So all of those things are there. So to protrude all of that, it has to be sizable to make a protrusion of all of those thick layers. So 23.4 millimeters, one ain't the reason I'm fat, it's me. Well, you said it. So yeah, so so yeah, the 2.3 centimeters, yeah, it's a small one. But go ahead, my bad. Oh, so to Ariel's point, so I am talking in Baton Rouge uh, about fibroids at the Southern Law Center. And there's a big thing. You guys will see like a post where I'm going down there to talk on Saturday, next Saturday, not this Saturday, but next Saturday. And they're raffling off virtual consultations with me. You'll just look at the post um, that will be posted talking about the event. So support the event. You want to learn about fibroids, women's health, and everything that I talk about on a bigger scale. Um, it's an awesome event, and again, like they'll be raffling off like free virtual consultations with me. So that's what Ariel was talking about. I was like, "What's she talking about?" I know what she's talking
You are very forgetful sometimes.
about. Hey, I can't be perfect. We all have our flaws.
All right. Well, I think that's a good wrap up point. Like I said, I screenshotted mostly everything I could get. Um, uh, Let me just make sure. Yes, yes, I have that one because I can heart them when I. So yeah, I think I got everything that I
You got it?
need except. Well, hold on. Okay.
Yeah, your phone about to go
Yeah,
crazy.
that was me pressing screen lock instead of screenshot.
Yeah.
I got it
So
though.
yes, that's a good question. She asking about tube unblocking. We'll talk about that next time too.
Okay.
Um, yeah, we'll talk about that one.
All right. And then last but not least, nobody's trying to join, right?
No, this is like the first time we haven't had
First
nobody
time in a
join.
long time. That's why I was saying,
Nobody
like, I
join.
didn't want nobody to think I was being rude because I
Nope.
definitely people who inbox me, I said, yes, you can join. And but I did stress
If you had
mini
many
consultation.
patients with enlarged uterus, yes, everybody got an enlarged uterus down there. They come to me, so yes, I do deal with that.
Okay. So yeah, I have everything. I want to, as always, thank everyone who joined tonight. Thank you who everyone who participated and submitted questions in advance. Those of you who submitted during. Like I said, I keep a running list. I definitely don't lose the stuff people send me. I'm pretty organized with the stuff. And like I said, sometimes I do have to combine. Some of you ask similar things, so I just make it concise where everybody can kind of get an answer out of it. And yes, I love Ariel because I am also able to send her posts to people who DM me with direct questions that y'all have discussed the topic. So she is amazing to your team.
Yeah,
And
and she saved that trash. Uh, what you call it? You used to say the picture
oh yeah.
that you had. She saved it. Shouts out to her because that damn thing was hurting,
Well, yeah. So my
See, I
best
was
friend is definitely known for not having her camera
took up
clean, and
with
she
an
took that
iPhone
picture of us.
2.5.
And
It
she
was
took that
horrible.
picture of us. So I
Yeah,
was like, I told her, I said, Toya, you need to clean your
yeah,
camera. It's always
yeah.
blurry.
Yeah, so everybody that saw our post about lives, that's all cola. I was just sharing them because I ain't had time to really make them, but that is all cola. Y'all laugh at her. Don't point at me.
Well, first, and I used to have creative reels that my kids would help
Ooh.
me with too.
Hmm.
But I
Yeah,
definitely like the new.
yeah, boy. Yup. There go that phone. There go that phone. Acting a mess.
Look at Toya. She in the comments. She said, "Oh yeah."
Yeah. Oh yeah. Oh yeah. Your phone is hot
And
garbaggio.
she has the
Yeah.
best iPhone out the crew. She just don't click. She said,
Oh,
"You ain't invited to
oh
the
my God.
cookout. You uninvited."
All right, I'm vegan now anyway, so y'all ain't making none. I can't even go to cookouts no more. Y'all eating all the damn chicken wings and
Oh
shit in
no,
front of
we
me.
have some plant based because her mom doesn't eat that.
Oh,
So,
okay.
but it ain't the majority. It's limited.
Oh, I bet you got like you can have some salad. The fuck?
No, 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 no. Her mom is plant based. I'm saying we have some items
Uh,
for those. We know, and we got the people who I don't. I'm Malcolm X. I don't eat pork. We got that too.
uh,
We think about it all, but it's
uh,
it's still not necessarily the plant stuff is not the majority. Yeah,
okay. I bet.
yeah. Nah,
Hmm.
we eat. All right. Well, thank you, thank you. Yeah, we know your 6-year-old takes your phone. We understand that's his
Mm,
fingerprint.
yeah, blame it on
Blame
the kids.
the baby. All the
Uh,
men passing the blame tonight.
yep. Thanks.
All
All
right.
right.
Well,
All
thank
right,
you so
everybody.
much, and
And
we
I'm gonna
will do
post it.
this
I'll post
again.
it. I'm gonna post it so everybody that want to see it, like it'll be on the page. So y'all can take a look. Um, and we'll I guess 2 weeks or so we'll do it again.
Yes, that sounds about right. I will give you my schedule in advance, like I've been doing, so that
Yes,
makes it
ma'am.
easier. Yes.
Sounds like a plan.
All right.
All right, everybody.
All
All
right.
right. Talk to y'all later.
Have a good one.
All right.
Bye bye.